I'm a Chernobyl survivor. I'm one of the sole survivors of one of the largest hospitals in the former Soviet Union. And so from a very young age, I know what it's like to be a patient. Given the limitations of the healthcare resources in the area where I was born, the physicians there were really unable to provide me the necessary treatment that I needed. And so I had to seek treatment abroad. From a patient standpoint, that's a lot of stress. One, going through one's disease, but then also the social aspects, the ability to connect to physicians, to find care. A decade later, my mom was diagnosed with cancer. And sadly, my mom was dropped by her insurance, then dropped by her physician, and there was a period of time where she was not getting any treatment whatsoever. And that's really what primed me to go into research. My story is unique because I see the disease from the perspective of a patient, the perspective of a caretaker, from a policy standpoint, from a research standpoint, and also from a clinical standpoint as well. I try my best with every patient interaction to understand that patient's unique circumstances, and I try to be a bridge, be a conduit, and connect them to care. Not just medical care, social care, or any other resources that are out there, because at the end of the day, the most important thing that one can do to provide great care is to be there for their patients. I never forget where I came from, and I never forget my past. I want to make a difference in the lives of patients, and the best way to do that is through research and innovation, so that we can pioneer the next generation of therapies and make a difference, a lasting difference in the lives of patients, so that they don't have to suffer like I suffered, like my mom suffered, and they don't have to suffer like the patients that are suffering today.